I'm going to cut in here because it's 8:30. Good morning to everyone else on the call. Thank you for joining us today. I do know a few people are having some internet issues. So this is being live streamed onto Facebook as always, and we will upload it as soon as we can and get it out on YouTube and Twitter and that stuff. So everybody will be able to watch this. So welcome to the York County Community Sector Briefing on April 15th. We are pleased to be here to update the community on what's going on. And let me introduce Laura McDougall with Four Corners Health Department, our Executive Director there.
Yes, good morning. Can you hear me all right? Good, okay. Well, we too are having some internet issues, and I think probably the first thing I should say is that our whole office runs on Spectrum phone and internet. So if you're trying to reach us this morning at Four Corners, we are waiting for Spectrum to come back up. You can try our cell phones, but other than that, or you can ask me on this briefing if you have a question. So to get started, this morning, I think I'll start off with talking about vaccinations. And I wanted to have our most recent numbers for you this morning, but of course, that would require internet to get those. So I'm going to give you yesterday's numbers for vaccines that we had given. We're almost up to 20, as of yesterday, we're almost up to 25,000 total vaccines given. We were at 24,742. We've given over 9,000 second dose vaccines, which means those people are fully vaccinated. And our first dose vaccines, we're at 15,658 yesterday. In York County, we're almost to 8,000 vaccines given. We're at 7,791. Again, that was yesterday. We'll probably hear from the hospital here to talk about their big vaccine clinic today that they're having and what that's going to look like. So we know that York County will pop up in numbers pretty good here today, and that's always a good thing. We are in our district, we have at least 46% of our population who's 18 and over have received their first dose, at least their first dose, and we have fully vaccinated the 29% of our population now who's 18 and over is fully vaccinated. So that is very good. When we look at our total population, that includes the kids under 18, that's everybody, we're at 22% of our population is fully vaccinated. And so that's kind of where we're at right now. Of course, we internally have a goal to get over, a goal to get over 70 or 75%. That's where we'd like to be with our vaccinations with people fully vaccinated. So, we still have a ways to go, and we would like to see everybody going and trying to get vaccinated yet. And we have vaccines, so please sign up on our vaccinate.ne.gov so that we can get you a vaccine. I want to talk a little bit about, you probably have heard in the news, it was all over, that the Johnson & Johnson vaccine is on pause as well. And it is as well here at the Four Corners District, where the vaccine is it's just on pause until we have further instructions. So it's still here, but we are not going to be giving any Johnson & Johnson until we are given the okay to do so. And, we do feel like we have a good supply of the Moderna vaccine. So that will be used in our clinics going forward until we have different instructions from the state and feds. So I think right now what we are working on here internally in our department is the plans for what we are going to do after we are not having people fill our mass clinic sites, the invitations. We have we know that our mass clinics right now, we are inviting people 18 and older to come in and get vaccinated, and they don't seem to be filling up quite as readily as in some of our areas of our district as they had been earlier. So, this is, if we're not able to fill our mass clinics moving forward, then we're going to have to scale back and decide what that looks like. But we do want to continue to have vaccine available in our district moving forward every week, that there'll be some place that you can get vaccinated if you choose to do so. So we're trying to figure out what that maintenance phase, what that moving forward phase looks like when we don't have the demand to have the mass clinics. So those plans are being developed right now. So again, we'd really like to, it's a lot more efficient for our communities, and it's also better to get that vaccine in people's arms as soon as we can, so that we're protecting as many people as possible with the vaccine. So it's important that people go to that vaccinate.ne.gov and get registered and to get a vaccine. It's also, and do it now. But it's also, if people cannot, if they're not able to use the website or don't have internet or are uncomfortable doing that, you can always call our health department too, and we'll make sure that we'll help you get through that process. So please do that. Just call Four Corners. I want to talk about our risk dial. So moving off of vaccinations a little bit, our risk dial now, we did add a metric in to, as we do our risk dial, that incorporates our vaccination rates. So with the goal in mind that we'd like to get most people vaccinated, we have that vaccination metric in our risk dial to incorporate. So right now we're in the mid yellow, and today we're going to use our last week's data and reset it again for next week. So that is a new development with the risk dial. Going over our new case numbers, for the last 7 days, we've had just 35 cases. And of course, that's looking pretty good. But we would like to see it lower still. We're still not satisfied with 35, but York County had 7 cases in the past 7 days, and Seward County had 24. So we have some things kind of popping over in Seward County, but Butler and Polk County each had 2 cases for the past 7 days. So York County had about a case a day for the last week. What we are seeing in terms of the people who are getting COVID right now, it's pretty impressive as we look at the numbers of who's getting COVID with the vaccination going on. We had one person in the last 7 days who was in their 80s, but the rest of the people who had COVID were 50 and lower. So age 50 and lower. So you can tell that, we've had pretty robust vaccination going on in 60s and up, and it really reflects in the COVID numbers that we're having. So other than that, I'm going to I think I'm wrapping it up here. So thanks, and I'd be happy to take any questions.
Thank you, Laura. We appreciate everything that Four Corners and your staff are doing. And next is up the medical sector. I believe Jim is on. So Jim, do you want to start?
I sure can, Lisa. Thank you and good morning, everybody. Statewide hospitalizations, I usually start off on, and it's been a little bit of an up and down week or so for state hospitalizations, but just checking this morning, hot off the update, if you will, from the state, is 155 as of yesterday were the total number of COVID hospitalizations. That was down from 166 on the 13th. So that was the 14th, 155, 13th, 166. It's only slightly up from a week ago, 151. So it appears like we're leveling out, but time will tell here. Back on the 9th of April, it was 173. That was, I hope we can say that was the new peak that we had when we were on an upturn, but again, time will tell. So we appear to be coming down a little bit from that, and that'd be a great thing to see. So our testing that we've done, I think, in a lot of hospitals in our district, you can hear this on the community or the unified command calls we have on Tuesdays, that it's kind of the same theme as what I'll tell you, transitioning from caring for COVID patients in our hospitals and testing COVID patients to vaccinations. And that's a good thing, the transition going that direction. So this past week, through our ER, outpatient and inpatient COVID testing that we would have done, we only tested 8. And that was about 15 were about a week ago. And we didn't have any positives. We haven't had a positive through our organization other than maybe Test Nebraska for the last 4 weeks on that end. So that's another positive thing for us. Not, pardon the pun there, but it's a positive thing there to have negative test results. And so Test Nebraska just got an update from Jennifer Elfelman, who's out at the vaccine clinic. We tested 11 tested yesterday for Test Nebraska. Now, just like others in the health district, we are going to suspend our Test Nebraska clinic. There just aren't that many that are out there. We still have the contract with the state. If we need to start it back up, but starting next week, we will suspend that Test Nebraska. That's the same as Butler County and Seward County have done in recent weeks. So no COVID inpatients at York General. And we've really only given 2 of the BAM and Estes combination that we've had for the variants that are out there of the infusions. Only gave 2 of those last week. And we currently still have 1 employee out for COVID-related reasons. That individual is coming off of that that time period as being COVID positive, coming off of that tomorrow. And so we will, knock on wood, be no employees with COVID out for COVID-related reasons. So vaccines, and again, there's an update that I've got just off text message from Jennifer Elfelman, again out at the clinic, that I'll give you as well. But statewide, Laura touched on numbers of our district, but statewide this morning, statewide is 31.4% of those 16 and over that have been fully vaccinated at the state level. That's 465,648 individuals. When I refreshed the data also this morning, and I think this is interesting to see, but back on Tuesday, there were nearly 49% of all those that were fully vaccinated were 65 and over. That now has dropped to 46.21 of the total percent, which means, as of this morning, which means those that are 64 and under are beginning to get vaccinated, which is good. I mean, the percentages have climbed in the 35 to 44 age category by over nearly 1% just in a couple of days. And so that means the younger people are starting to get vaccinated, which is what we want to see. Okay, so here's where our clinic is today. We had planned on, we don't know where it's going to end up today, but we planned on at the beginning of the week to hopefully give 400 first doses and nearly 190 second doses. And I could tell you the update that we have. Those of you that follow us on Facebook know we had a lot of open spots. Still yesterday, we had 300 spots out of that 400 open for vaccinations. And I don't know how many we're going to end up giving, but this is the latest numbers is we have 190 that are due for second dose today, and we only have 170 signed up for first dose. That means we have 280 open spots. So spread the word if you need the vaccine to, vaccinate.ne.gov for the place to go to sign up and get and then get onto the vaccination system to sign up. And you can call us too, I'm sure, to get signed up as well, because we have a lot of doses available. This is where Laura was saying it's been harder to get individuals signed up, and we'll begin in the weeks ahead to transition from a mass vaccination to what are we going to do ongoing. for maintenance vaccines or maintaining or getting more people vaccinated more slowly over time due to the volumes. Transitioning away from the vaccines just a little bit, the Hearthstone still has a census about where they've been in recent weeks. We've had more inquiries, more admits, but unfortunately some discharges as well from care. So 87 is where they're staying right now. In-room visits continue to go fine. We are finishing up Friday with the resident testing that was required due to our positive employee that was in the Hearthstone. And they really had minimal contact, but we still, for precautions, had to test the residents for a couple weeks. And so Friday's our last testing regimen. And yes, they're mostly vaccinated, but that's the protocol that we do. And provided there's no positives all the way through Friday, then we're back to being removed from the quote outbreak status that we were in. If you have one positive and has exposure potentially to residents, you're considered outbreak at that point. And so we should be, knock on wood, in the clear tomorrow on that. Willowbrook is just humming along with 44 residents there, essentially getting really nearly full. And no news is good news here. The visits continue to go well. So our I-80 clinic continues to move along and get closer and closer to completion. Supply and demand in the building world is getting harder to come by certain things, and we have a few items that are going to be delayed getting to finish up our clinic till probably the beginning part of May. And so the middle part of May is when we're going to be prepping inside for opening. Don't know if it'll be late May or June before we actually open up the doors. And so again, stay tuned for for announcements of when open house will be as well. Respiratory therapy in-house, they continue to click along, transitioning our respiratory therapy department into our old pharmacy space on the main floor of the hospital. And right now that's targeted for the end of May, when we could have that open as well. So some other improvements, some things away from COVID and some improvements that are moving our organization forward. So those are my comments today. Thank you for the opportunity to talk.
Thank you, Jim. I don't have a report from Henderson Healthcare. However, Lisa is on here. If you have any questions on Henderson, please feel free to put them in the chat. She has mic issues and she'll respond to you in the chat. Is there any other medical people on the call today? Okay, so we will move on to the education sector. And I'm not sure if we have any of our superintendents on. If you are, now would be the time to speak up. I know they're all busy with end of the year stuff. Gal, do you have anything from your college? Yeah. They are also wrapping up towards year end. Your college is about done and students are finishing stuff. So we will move on to our local government sector. Barry, do you want to start?
Sure, I'm glad to start. I'm using a different computer, so I'm not sure where to look today. So my camera's in a different spot, but just a few items tonight at our council meeting will be Joe Fry's last official meeting as city administrator, and I'd like to thank Joe for everything he's done for the city. His final day will be next Friday, but we'll be around to help the city during transition period as needed. So appreciate that, but want to thank him for the time that he spent here in York. And we have some things in the works that we'll have some announcements on some things in the very near future on where we're going with some of our staffing things over there. We still have some open positions and we're trying to find solutions to those. I think anybody that's trying to hire anybody right now knows how hard it is to find people, and we're really struggling. And we're still looking for that director of public works too. And you know, we talked to our engineering firms, and if any of them had anyone to recommend to us, they'd be hiring them themselves. And so, but we do have people looking, and we will get that position filled sooner than later. So the auditorium, the final punch list, I think, is being worked on. I think the fire marshal is kind of signing off on the last things today that we got done, and we still have a few little details, but I think the chamber ambassadors are even going to stop by today. So if you haven't had an opportunity to see the improvements to the, you know, the gym area and things, do stop by. It's open during the day, but it really is kind of a neat how we've saved that building. So I think that's great. The community center work is going on. We've had a bit of a setback with that we're having to look into a roofing issue. And an interior roofing issue that we're trying to get some data on. So once we have some more information with that, we'll share it with the community and maybe a new time frame on when we think we can get all that done. If anybody's tried to get anything, trying to get steel and things, I think, as Jim pointed out, is a real challenge now as you're trying to do projects. So yeah, and I know that Four Corners is sponsoring a hazardous drop off at the landfill on Saturday. And then the city is sponsoring a cleanup day where the landfill will be free for people to bring things out there the next Saturday on the 24th. So I hope people take advantage of that. I know some people have been sensitive lately about some properties in York and kind of their condition, and we are looking at that and looking at solutions, and some staffing will help so that we have somebody that can make those contacts. But we are trying to stay up with some of that, and we know sometimes it's a problem for some people. How they keep their yard and what they think is art isn't exactly what their neighbors think it is. So we run into some difficulties of what is appropriate, what is cleanup. But there is no question there are some properties in town that need to be cleaned up. And hopefully now, as we're getting past COVID, we can work with the housing authority again. We were talking about some minimums that we were going to set, you know, for what made a house livable. And I really hope that we can get back into those conversations. You know, I just don't think that a house should be rented to anyone that doesn't have a floor or plumbing or electricity. And I know you find that hard to believe that that's going on in York, Nebraska, but it is. And there are some examples of it, and we need to put a stop to that. So that's something that I hope to work again with the housing authority very soon. But I'm very excited for the next few months and for some of the things that are going to go on in York. And so so stay tuned, and everybody have a great day. Thank you.
Thank you very much, Barry. I do not have a report from the county, which tells me all is good. I know they're starting to look at what next year looks like as well. Bill had told me that they've done a lot of work on roads and bridges and stuff like that, and some of that's been in the news. But I know when I talked to him last, he was talking about that, the roads issues. If there's anyone else, I know I see some of the other communities. Now would be the time to hop in. Otherwise, we will move on to the faith community and our nonprofits. Jake Owens from York County Health Coalition was not able to join us this morning. However, he said he really doesn't have any updates. Just a reminder, though, that through this month on Facebook Live in the mornings on Saturdays, is a cooking class that's free to the public. If there's somebody that needs some help getting the food that's needed for those cooking classes, they can reach out to the Health Coalition. And there's a partnership with the grocery stores in the county for that. So is there anyone else from our nonprofits that would like to jump in? Okay, then we will move on to the business sector, and I don't believe Madonna or Rhonda are on. If I'm wrong, feel free to jump in, you guys. We have a lot going on in our business community. You're seeing the construction out at McLean's that we're hoping it's opened in June. There's been some construction delays due to the supply chain, similar to a lot of the other construction projects. Next week, we do have a lunch and learn. Mike Hinkie is focused on taking customer service to the next level. I did not have a chance to check numbers. We have slots for 35, and I think we were getting pretty close to that yesterday morning when I looked. But if that's something you want to attend, reach out to us today. We have YCDC has been asked to partner with the Center for Rural Affairs for a USDA grant. If that is funded, it would give us the technical assistance through the Nebraska Food Policy Council and the Center for Rural Affairs to move some of the goals we identified in the Local Foods Local program forward over the next 3 years. It's a 3-year grant to implement strategies countywide, all the way down to neighborhoods. So we're pretty excited. Don't know if that will be funded, but we are working with them on that. It gives our community really good opportunity. And then Economic Development Week is coming up May 9th through May 14th. Earlier this week, we released a virtual training, the importance of LinkedIn for that week, and it's open to YCDC members, and we're offering it to them for free. We're paying for the training. It is virtual because our trainer's from British Columbia. She's a LinkedIn trainer, and there's no way we can afford to bring her in right now, especially with COVID. She won't even travel. But if LinkedIn, we really need to be focused on and making sure we're doing it right for those that are doing LinkedIn. So that's why we're offering that. We are also working on our next round of podcasts to tell the York County story. And our next session is focused on makers and builders. So Derek is working on that, and that will be coming out in May. So that will showcase some of our small and large businesses. So we're pretty excited about that. Otherwise, I don't have anything. Is there anyone else on the call that wants to say something right now? Okay. And I do not see any comments on Facebook or on Zoom. So I think we can go ahead and wrap something up unless somebody jumps in. We can wrap the meeting up today. And we will see you in 2 weeks. Everybody have a great weekend. Enjoy the sun. Thank you, everyone.
Thanks, Lisa.